Have you ever really looked at your own head? I don't just mean a quick glance in the mirror. I mean, have you ever stopped to think about the incredible story it tells? Well, today, we're going to do just that. Let's go on a fascinating anatomical tour of the most complex and personal part of your body. But first, let's start with the really interesting puzzle. Why is your face tucked neatly underneath your brain instead of sticking way out in front like it does on, say, a dog or a horse? It seems like a simple question, but the answer, well, it gets to the very heart of what makes us human.
And this shows you exactly what happened. For an animal like a dog, which is guided by its incredible sense of smell, it makes sense for the snout and face to lead the way. But for humans, a completely different story. Our brains just kept getting bigger and bigger and bigger. To make room for this new supercomputer, our cranium had to expand up and out, basically pushing our entire face down and underneath it. Our whole head was reorganized around our brain.
So, it only makes sense to start our tour with that very structure, the cranium. Think of it as more than just bone. It's the high-tech, protective case for the most important organ we have, the very thing that makes you, you. Okay, this is where it gets interactive. I want you to actually touch your own head. Go ahead. That smooth part of your forehead, that's the frontal region. Now, slide your hands to the sides and the top of your skull. You're now feeling the parietal region. And if you feel around the back of your head, right in the middle, you should find a distinct little bump. That's a key landmark called the external occipital protuberance.
Now, find your temple on the side of your head. There's a spot there that looks pretty ordinary, but anatomically, it is so important. It's called the pterion, and it's this really cool H-shaped meeting point where 4 different skull bones all join together.
So why are we so focused on this one spot? Well, here's the crazy part. This intersection of 4 bones also happens to be the thinnest and weakest point of the entire skull. This makes it a really dangerous place to get hit, but it also makes it a critical access point for neurosurgeons. All right, from the protective helmet of the cranium, let's move down to the face. This is our body's interface with the world. It's how we see, how we hear, how we eat, and of course, how we communicate with each other. Let's just take the ear, for example. On the left, you've got the map, and on the right, you see the real thing. That outer rim is called the helix. The fleshy part at the bottom is the lobule, your earlobe, and that little flap covering the canal is the tragus. These aren't just random squiggles. They are perfectly shaped to capture sound waves and funnel them inside. You ready for another one? Go ahead and place your fingertip right in front of that little tragus flap we just talked about. Now open and close your mouth. Feel that? That movement is your temporal mandibular joint. It's the hinge that lets you talk and chew. You've just located a perfect example of your own anatomy in action.
And your whole face is covered in these key landmarks. You've got the nasion, which is that little dip at the top of your nose, and the zygomatic arch, that's your cheekbone. This facial map is absolutely essential for everyone from artists trying to draw a portrait to surgeons in the operating room.
So why does all this matter in the real world? Well, that brings us right to the clinic. Knowing all this surface anatomy isn't just an academic game. For doctors and nurses, these external landmarks are vital clues that can point to what's happening inside the body. For example, imagine a doctor sees a patient with a painful swelling right below and in front of their ear, and this swelling is so pronounced it's actually pushing the earlobe up and out. Well, a light bulb goes off immediately. That external geography of the face is a classic sign of the mumps virus. The diagnosis starts right there. Okay, take a look at this number, 93%. Just let that sink in for a second. It's a huge number. What on earth could it be referring to when we're talking about the human head? Well, here it is. A staggering 93% of all carcinomas of the lip occur on the lower lip. That one simple piece of anatomical data is absolutely crucial for early screening and detection. Knowing the map of your face can literally be a lifesaver. Okay, so we've looked at the structure and we've looked at the clinical side, but what about the features that make our heads uniquely human? This is where we get into the anatomy of our very identity as a species. I mean, if you put a human skull next to that of another primate, the differences are just striking. We have a prominent external nose, our once massive brow ridges have shrunk way down, our dental arches are much broader, and then there's the big one. We have a projecting chin. No other primate has that. It's our thing. And the source material really hammers this point home.
That bony part at the bottom of your face, the mentum, is one of the defining characteristics of a modern human skull.
So, why a chin? Is it just for looks? Not at all. The unique shape of our jaw, including that projecting chin, actually creates a lot more room inside our mouths, and all that extra space is what gives our tongue the freedom to perform the incredible acrobatics needed for complex, well-articulated speech. Our anatomy, quite literally, gave us our voice.
So, when you step back and look at the whole picture, it becomes so clear. Your head isn't just a jumble of anatomical parts. It's a living document of our evolution. It's a story about a species that bet everything on brain power, on communication, and on social connection, all written in bone and flesh.
We've just given you the map to the most familiar landscape in the entire world, your own reflection. So the next time you look in the mirror, don't just see a face. See the story. Now that you know the landmarks, what story does your face tell?